Well, good morning, everyone. It is time for another edition of Weekly Wellness. It's your girl, Comedienne Joy, and I'm joined here with the magnificent Dr. Mia Cowan. She has her Christmas tree all up in the background, and Joy just
Mm-hmm.
looking like regular. But I have Joy always, even though I don't have that nice, beautiful Christmas tree, and I know some good presents to put under there, Dr. Mia. Some supplements.
Yes.
Some
Some supplements.
supplements.
Yes.
Yes.
What's up, y'all?
How are you this morning?
I'm fantastic. How are you?
I'm doing good on this countdown to Jesus'
I
birthday.
know all the things. Happy New Year, Merry Christmas, all the things. So, what's up, y'all? I'm Dr. Mia, your B3 specialist and board certified gynecologist at Bella Wellness Center, where we offer gynecology to women and adolescents, as well as some amazing wellness services for both men and women, including hormone pellet therapy, weight management, intimacy services, total wellness with supplements, and laser hair removal. Our goal is to help you live well, age well, and experience what? Everlasting
Everlasting life.
intimacy for
Intimacy to the
life,
God.
whole life.
Yes.
So today we're going to talk a little bit about how to live in this poison world with all the bad additives in our food and with our food not necessarily giving us all the nutrition we need, so that we could talk about some other ways to supplement your diet with great supplements that will help you live your best life as far as energy and hormones and weight management and all the things. So that's what we're talking about today, Comedienne Joy. Hey, give us an update on what's going on with you, because I know it's the holiday season and we got the eat, drink, and ride and all the other things that you're doing. Just give us a quick update and we'll end with a better update.
Okay. Well, Joy recently got back from, she did a girls' trip. That was awesome. We went to Cancun, and so now we're planning Girls Trip 2025. We're going to go to Antigua, which is where Joy will be
Mm.
spending Christmas because this cold weather just ain't working.
It is not doing it, girl. You know I'm supposed to be in Jamaica for Christmas or
Yes,
for after Christmas anyway.
well, good. As long as we get out and get a
I'm
change of
not.
scenery.
I ain't going nowhere. I'm gonna be stuck here
Oh
in
Lord,
these
you're gonna be
United
packing
States
up
of
those supplements.
America. In these wonderful United States of America for the new year. You know, I like to leave the United States of America for the new year and
Exactly.
go somewhere where people are happy to see me and they welcoming me home and stuff. But I'll be here instead.
Yes, but we
Not so
still welcome.
welcomed. No, not so much. Not
Yeah,
everybody.
what your patients love you.
My patients and my family and friends do love me. Yes, and I love them as well.
Exactly. So, we're going to get you healthy on the inside, and then I'm going to help a little bit with the outside. And then together with the both of us, we're going to have some happy, whole people. But also, I know today we're going to talk about supplements, but we know in a few more days, everybody's going to be eating and packing it in. But I've been following you. You've been telling us about weight management and healthy tips and
Mm-hmm.
things you can do. So really, me personally, I'm going to cut back on some of the drinking. And one thing
Mm.
that I learned off my last trip that tremendously helped me, because I've been traveling like the last 3 years, and I would always bring back 6 or 7 extra pounds. And I'm not talking about souvenirs. This last trip,
Right.
I made sure I drank more water. I came back 2 pounds heavier. So for me, that was
That's
a
huge because
game
that's
changer.
just water. That's water weight anyway. That's probably the extra salt from eating at restaurants the whole time. So you probably had that off in a couple of days.
And I did. So I wanted to be able to share that with our audience. Is we know that the Christmas time is the most beautiful time of the year. However, incorporate more water. It's the one thing that Dr. Mia has been telling us for years. Even though you eating all them cookies, cakes, and pies, drink a glass of water with all that
Right.
liquor, all them Jack Daniels and all that vodka. Add a little bit more water to it, and
Right.
that way
That's what
you
I
won't
say
be
for.
so depressed.
That's right. And you won't be so tipsy. But I also say, like, after every drink, try to drink at least a half a bottle of water or a few ounces of water to stay hydrated. I think that's a great idea. But I also like water too for during the meal so that you eat fewer calories. So a lot of people, when we were growing up, we were taught, don't drink anything, eat all your food first, and then you can have something to drink. Well, when we're over 35 and we try to maintain a healthy weight, the best thing we can do is drink water, plain old water with our meals, sip water between between bites. Make sure we start our meal off with water and continue to drink throughout. And what we find is that it slows us down with eating so that we can recognize we're satisfied well before we overeat. So water is great for hydration, satiety, detox. So many different things for the skin. You know, we're always working on our skin at this age too. Even for intimacy, water is very important, especially for men. It helps with blood flow for women. The more water, the more hydrated, the better the blood flow. So
Wait, back this up. You said blood flow, so what are they supposed to soak it in water? I mean, how does that work?
They just supposed to drink water so that they have plenty of blood flow because they're hydrated. When you're dehydrated, you don't flow as well. So for intimacy, men need blood flow and women need blood flow. So drinking the water also helps to keep you hydrated so that you have good blood flow to all areas of your body, because blood flow stops at the least important areas for life. So it's going to always have plenty of blood flow to the heart first and the brain first. But then after that, everything is secondary. So if you're not hydrated and you don't have enough fluid, you're not going to get as much blood flow to your other extremities, like your genital area, your feet, your hands, the tips of your hands, the cold feet, the things not working properly because of lack of blood flow. So water is going to be key to healthy living, healthy intimacy, as well as weight management.
And it also helps you to be clean. So that way somebody want to be up under you because you done bathed and washed that thing.
Yes.
And yes. So
and just hydration helps, like you said, even with all kinds of, secretions and odors and all those things. Being hydrated is just very important for so many different reasons.
Yes. So wash before, after, and I guess during, because hopefully if it's right, you'll be thirsty. But
keep your water bottle on the bed, on the nightstand.
Hey, you got to be ready. But today we're going to talk about supplements, because we know that with our food, a lot of us are not eating properly. A lot of us are not eating healthy. And there are certain vitamins that we need. And I would assume, Dr. Mir, as we keep getting younger, that we may need different types of supplements. Is that right?
That's right. Different supplements. So some of the main ones I say, so we'll start with, we know it's that time of year. I was just at American Family Care with my mother, making sure she wasn't sick yesterday. So we know that it's the time of year when everybody's going to get the upper respiratory infections, the, runny noses. You're more likely to get COVID, flu. A lot of people didn't get their vaccines. We won't even talk about that. But we do know that there's some supplements that you could take that actually help with your immune system. So one of my favorites is just plain old vitamin C. I like our vitamin C because it's a full spectrum flavonoid, so it absorbs really well, but it's got a good amount of vitamin C. You could take 2 to 4 of these a day. I usually take 2 a day. And that's going to be good for your vitamin C to help with your immune system. And we have another really awesome one called Immune Boost. And that's something I definitely take during this year because it's got a lot of supplements and some herbs in it that are going to help with your immune system in general to help you fight off infections and colds and flus and all the things that go around during this season. So very good for your immune system. And then something else, zinc. And vitamin C and zinc also are going to help with your skin. You know, I'm all about the skin and keep anti-aging with the skin, but vitamin C and zinc both are going to help with your skin. So zinc is good for your immune system to help you fight off all these bugs and all of the germs that are going around. Of course, washing your hands plays a huge role. And I think everybody needs a supplement that's just vitamins. So this one has like all of the different vitamins that you would need. The vitamin D3, everybody should be taking for their immune system, with the A and the K that really helps it to absorb better. And so many other vitamins just in your everyday multivitamin that we should all be taking, because we know we're not getting the same nutrients from our food that we used to get. And then finally, most women need a good probiotic, and I really like our probiotic. And just a little bit about our supplement line. It's called Ageless Balance by Dr. Mia. And this is our Mia Cowan MD brand. And we like these supplements because they are made by naturopathic doctors. This company's been around for over 25 years. A lot of them are vegan products. They don't have a lot of fillers in them. They have high quality herbs. They are tested to make sure that they have in them what they should. So they're high quality vitamins. A lot of times when you just go grab supplements off the shelf at Walmart or just the regular store, they may have a lot of additives and fillers and other things that aren't necessarily good. And they may not have enough of the herbs that you need in order to get the real vitamins that you're trying to get. So I like this brand because I know they're high quality, they're tested, it's been around for a while, and I know that you're going to get what you need. And that's why I started this supplement line, because my patients were just going to the store and grabbing a vitamin C off the shelf. And if you read through it and see all the different fillers in it, you're like, this probably isn't a good option. So we have a wonderful supplement line that has in it what it says it has in it. It's tested, it's verified, and they've been around forever. So supplements for the immune system. This is the time of year. So some good supplements that you can take to help with your immune system. And that's also why I like this vitamins, because it's got the vitamin A, the K, the D3. It's got a little bit of C. It's got all the things in it. But other supplements that work well. Vitamin A is going to be good for your immune system and your skin. We talked about the vitamin C, the vitamin D, the zinc, the immune boost. And then elderberry is also good. So if you know you've been around somebody that's sick and you really need to just boost your immune system, that's good. And another thing that I use is with my juicing, I always put ginger and a little turmeric in my juices, because ginger and turmeric are really good for your inflammation and anti-inflammation, as well as your immune system.
So are these specific? I know a lot of them, like with the zinc and the elderberry, that's good for this time of the year with the colds. But the probiotic, what age is good for that? Because I know our body changes again as we keep getting younger.
Mature.
Right.
So I think anybody that's suffering with a lot of constipation, irritable bowel syndrome, so alternating constipation, diarrhea, their bowels aren't moving well, they have a lot of GI upset, I think a good probiotic works well. Probiotics also work well specifically for the vaginal tissue, keeping that pH nice and stable, decreasing the bacteria and the yeast that you get from your pH being thrown off. Probiotics help with that. We have this wonderful probiotic in this line, and there's also a specific probiotic for the vaginal tissue that you can take over the counter called Claire V. So for those women who keep getting bacteria and yeast and they're doing all the other things that they need to do, that's one specifically that absorbs in the vaginal tissue. So probiotics are good for your GI tract as well as so many other things in your body.
Interesting. And so should we take them once a day? What medications, common medications should we think about? Oh, don't take this with that.
Right. So I would say for most of these supplements, they're herbs that you would actually find in food. So most of them aren't, like somebody who has really high blood pressure shouldn't take stuff with licorice in it. So there's a few little like no-nos, but for the most part, most of the supplements are going to be fine because it's really food. You know what I mean? It's really food products and herbs that you're getting. So it's not like you're getting some synthetically made or man-made product that can negatively affect the other medications that you take. But I would definitely say for those people who have high blood pressure, you definitely want to avoid licorice because that can raise blood pressure.
So
but
you're
that's
just
the one.
taking licorice supplements. I mean, licorice is gross.
Right, but in some of the supplements we do have licorice in them because it does have some other benefits that I can't remember right now. Okay. But licorice is good. I think it may be good for the GI tract, but y'all look that one up. But licorice is good, and it's in some of the supplements that we have. But that's the one. If I know somebody has uncontrolled blood pressure, they have a hard time controlling their blood pressure, I have them to avoid the ones with the licorice in them. And on all of our supplements, you can go to mebellawellness.com, click on the shop link. And then you can kind of study the different supplements. You can put in what you need them for. It'll pull up a lot of those supplements. A lot of them are in bundles. So we have like a weight management bundle, for example. So this CLA is one of my favorites to take because the CLA and the alpha lipoic acid help with your skin, but they also help with your insulin levels and your sugar levels for insulin resistant patients, which many of us are. Even if our numbers don't show that we're pre-diabetic or anything, many of us are insulin resistant. So lowering those insulin levels definitely makes it easier for weight management as well. So the whole weight management bundle has the CLA, the alpha lipoic acid. We have one that's called Mood and Appetite, which is actually 5-HT, and it helps with emotional eating. You can easily take that during the afternoon. We also have a Meta Boost. The Meta Boost has like Garcinia cambogia, African mango, and all of these green tea, and all of those things are going to help with your appetite and with your metabolism. to make weight management easier. And then we have some other ones like the sugar control and the cycle balance. So even our women with PCOS who have imbalanced hormones because of high insulin levels, we have a bunch of supplements that work really well. So some of my patients who can't tolerate the metformin, don't want to take metformin, they could take the alpha lipoic acid, the CLA, the sugar control, and the stress relief and get some of the same benefits. So the supplements work really well. They're high quality. They have in them what they say they have in them, and they really do work depending on what you need them for. I even have some to help with energy. So one called adrenal. So a lot of times it's your hormones that are off. Sometimes it's your neurotransmitters that are off, but also think about the adrenal glands and the function of the adrenal glands, which do help with energy and immune system and all of those things as well. So that's another way to help deal with energy. So if you're already doing all those other things and you're finding that you're still tired, we've ruled out thyroid disease, ruled out vitamin deficiency, ruled out the hormone imbalance or fixed it. Then the next thing you start thinking about is my adrenal glands. What's going on with my energy from that perspective? And you can always supplement with supplements that naturally help with your adrenals that will also help with your energy and your immune system.
So with these supplements, this is something that can be taken long term, should we say?
Yes.
Okay.
And that's what I really like about the weight management stuff, because a lot of the drugs that we use to help with weight management should really be short-term drugs, not something you take forever. But with these supplements, you could take them forever, every day, for your immune system. You know, I'm not going to take 20 supplements a day, every single day, but there are some that I'm going to take because I know they're going to help me with my weight management. They're going to help me with my energy. They're going to help me with my immune system. I think every woman needs a good omega-3 as well, because that helps with your brain. That helps with your joints. That helps protect your heart. Same with the vitamin D. It helps with so many things besides the immune system. It helps with energy. It helps with sleep. It helps with mood. It protects the heart. It decreases the risk of cancer when we keep that vitamin D3 level up above the 50 to 60. And it is D3 specifically that I like to replace. And again, it does absorb better when you have the A and the K2 in that vitamin D3, or you're taking another supplement with the A and the K2 for better absorption of the vitamin D3. And that's something that can actually be monitored through your lab work to make sure your vitamin D3 and your B12 levels are up, especially if you're noticing more fatigue.
All right. And speaking of, when should we take them? Before food, after food, before we go to bed, early in the morning?
Good question. So all of them are different. So the ones I take, like when I first wake up, and I always take them after food, because sometimes some supplements can make you nauseated if you take them on an empty stomach. So I usually take like my vitamin C, my vitamin D, my zinc, first thing in the morning. And then a lot of times I'll do my next set of vitamins with like my morning snack. So I'm not taking so many together. It doesn't cause nausea. And I know what I'm taking. And then some vitamins I don't take all the time. So when my immune system is stronger in the spring months and the summer months and all of that, I may not take as much of the immune vitamins, but I'm usually always taking some things to help with my appetite and to help with my metabolism and still help with my immune system. And then again, taking that multivitamin is going to be key for so many people, because again, our food doesn't always give us all the nutrients that we need, but we can supplement with high quality supplements that will help with everything, so many things. Even the cycle balance works really well for my patients who have irregular cycles. They're trying to get pregnant, or they just want to regulate their cycles and they don't want to be on hormonal birth control. The cycle balance works really well for that. And like I said, the other supplements that work good for insulin resistant are going to be great. We even have some for mood, to help with mood, to help with focus, to help with energy, you name it. We have some to help protect the bones, even like the DIM Plus that a lot of our patients who are on hormones use, and that's breast protective and prostate protective. Just a supplement that you could take every day, that you could, and like I said, most of the supplements are nutrients that you would get out of your food if our food was processed and prepared regularly and normally like it was 20 or 30 years ago. So since we can't always get it from our food, we definitely can supplement with some good high quality supplements.
And I'm pretty sure we can go on your website because I think you mentioned it if we want to purchase some of this. But what if we're a little bit nervous about the mail system, may not get it in time for Christmas because it may make great gifts? Will you be open before Christmas that people can walk in and possibly get some of these amazing supplements to
Supplements.
make great
Yes.
Christmas gifts?
Definitely. And I would say if you know specifically what you want, just call the office first. And the good thing is our supplements come pretty quickly. So you can order them online and you will have them usually in 2 to 3 days if you order them online because you can't get to us. But many of the supplements we do keep in office. But we also have a huge number that we don't necessarily keep in office because everybody doesn't need them. Oh, another good one is evening primrose for like PMS. So those people who have the breast tenderness and the mood changes and all of those things from PMS or premenstrual syndrome or PMDD, the evening primrose works really well for that. For those women who are noticing changes in the hair is starting to thin and shed, we have some great biotin products as well that help with the hair. And we already talked about the skin and increasing the collagen naturally with some of our other supplements that also help with weight management. So the good thing is that a lot of the supplements are going to do several different things. And the other good thing is that we have some wonderful weight management supplements that you can take long term. So once you reach your weight management goals, you can take some healthy supplements to help maintain your weight loss and your weight management.
And the other thing is still the basic, it's diet and exercise.
Exercise. Exactly. So, like I said, diet is going to be key. We can't always get everything we need nutrient wise from our food, so we can supplement with it, but still basic things with your health and your wellness, making sure you're having breakfast in the first hour. I think that's the most important meal and the most forgotten meal by most people. Most people don't eat breakfast because if you're not eating it within that first hour of waking up, you're not eating breakfast. You're skipping it. And the easiest way to gain weight is to skip breakfast and to not drink enough water. So if you want to just not lose weight, start skipping breakfast and eat 1 or 2 meals a day. That's the easiest way to gain. The easiest way to maintain healthy weight and to lose would be to eat like skinny girls, okay? Eat all the time. So frequent small meals, not going over 3 hours between breakfast and dinner without eating, and having that breakfast in the first hour of waking up or working out if you work out first thing in the morning. But breaking that fast is key to metabolism. And like I said, the people who don't eat breakfast, I tend to know it because when they come in and they do their rest and metabolic rate test, their metabolism is really low. And it's low because they always starve themselves, so their body stays in starvation mode and stores fat because you are starving your body by not breaking the fast first thing in the morning. So we have got to get into the habit of eating breakfast. And you don't have to think you have to eat a big eggs, bacon, biscuits, grits, and eggs. That's not what I want you to eat. A protein shake, a few nuts. Start it off with some fruit. Juice you a lot of vegetables and fruit, and just wake up that morning within the first hour and drink your glass of juice. And then 2 to 3 hours later, eat your protein meal. But getting that protein in, the 60 to 90 grams, depending on your weight, having those frequent small meals, making sure they are heavy with protein, healthy fat, and fiber. All of those things are going to help with weight management, total wellness, like aging well, having the energy throughout the day, you know what I mean? And then making sure you're holding on to your muscle mass, which helps with your bone mass, which helps with your metabolism and makes it easier to lose the weight and actually keep the weight off. So many factors in your lifestyle, but like you said, Comedienne Joy, most importantly, eating healthy, choosing the right foods, exercising regularly, and paying attention to what you're putting in your body that you should be treating like a temple.
All right, so let's hit this real quick because I know a lot of us, especially next month, we're going to be trying to eat all these salads. What should a healthy salad look like? Because people that look like us, it's going to be white on top because they're going to drown it in that ranch dressing.
The ranch dressing. So it should be colorful. So when you think of your meals, think of color. So in my salads, I get like the different colored tomatoes, the small ones, and cut them up, or the big ones, and cut them up. I do like red peppers and green peppers and yellow peppers and orange peppers and the cucumbers and the different lettuces. I like to put olives because I like the olive oil and I like healthy fat. I still put a few croutons in my salad too. Sometimes I'll put almonds and walnuts. And then with my dressing, I don't I sometimes will do ranch, but I just do way less dressing than I used to, and I mix it well. But I really do like doing the vinaigrette. I like the one with the strawberry on the front that's got a sweeter kind of taste because you don't need as much of it. So it's not going to be high calorie. And then I try to get one that's got the olive oil and the healthy fat and all of those things in it so that I can still enjoy my salad with good flavor. And sometimes I do ranch, but instead of me pouring a whole thing of ranch all over it, I may do a little bit of a dip with my ranch and just have a small amount and dip it in there so that I'm using less ranch dressing. And a lot of times if I decide to use ranch, I will do it with the vinaigrette just so that I can use way less of the high fat, high calorie ranch. And I use lower calorie dressing and just add a little bit of ranch for flavor. So you can be creative. You can mix your salads. You can put them in one of those salad mixers where you can put way less of the dressing and you can mix it around really well. And then it's not a problem with you overdoing the dressing and creating too many calories for yourself.
So basically, not a plate full of croutons and ranch dressing,
but
and we
more
have
the
fresh stuff on there.
Yeah, the fresh, colorful stuff. And I don't like bag salad because it does taste different. It does have a funny taste with that preservative. So I always get my own lettuce and stuff and cut it up. And I get it in the plastic. For some reason, when I get it in the plastic containers instead of the plastic bags, it has a different smell to it. But yeah, getting the different kinds of lettuces, making sure, you have some good, healthy, like kale and arugula and spinach, so you can get multiple different types of lettuce as well. And now they have a lot of the different like you can do the beet leaves, and there's so many different like nutrients that you can add to it that don't have a lot of flavor, but they help with the nutrients, help with your GI system. Because the one thing about weight management as you age and mature, and about the Asian woman, is your GI tract does change, and a lot of women will experience constipation. So doing a high fiber diet makes a big difference in controlling your regular bowel movements as you age and mature.
So we got to get that out of there, because that I'm sure adds some weight.
Yes.
When you get on the scale.
And you detox by getting it out of there. You know what I mean? It's usually stuff that needs to come out, so you don't want to just sitting in your GI tract. So yeah, making sure that you are eating the right foods, so that, because if you eat all the time every day, if you eat 2 or 3 times a day, you really should be going to the bathroom at minimum once a day, but really more like 2 or 3 times a day. If you're eating that frequently and eating the right foods with the right amount of hydration, water, fiber, and all of the things. But a lot of the processed foods are going to constipate you. So being cognizant of what you're putting in your body, getting higher quality foods, eating more of the whole foods that God put on the earth, because that's going to give you more nutrients as well, and decreasing those processed foods that you are having to open up in a bag because somebody processed them to make them.
Well, there you go. So again, we know, get all of those immune building supplements, because it's that time of year. That's an obvious. But then also, as you age and may have hormonal issues, then you want to go back and replay this video and share it with a friend. The other types of supplements you can get just based off of some of your body needs, and they can go to MeBella wellness.com, and they can see a whole list of your supplement store.
That's right. And we're going to be really focusing in on the supplements this year, because again, it's food is medicine. Okay. And then everything, a lot of the things that we need for our health and our wellness, God put it on the earth naturally, and we can get those in a supplement form now. So making sure that you understand your body, pay attention to what your body needs. You're paying attention to your energy levels and how you're sleeping. But it's supplements on there to help with sleep naturally. It's supplements they help with energy, and they help with mood, and they help with focus, and help with so many things. And then if you know that you're already at high risk for certain things, or you have more inflammation, there are certain supplements that we can use to help with that too. And then cooking with the right herbs, making sure you're using the real herbs that God put on the earth to help season your food, so you can get the nutritional value from everything that you put in your mouth. So looking at whatever I'm putting in my mouth, I'm trying to use it as medicine to my body, so that it can help me feel healthier, be healthier, have the energy I need, be able to maintain a healthy weight, be able to control my muscle mass and my bone mass. But looking at food as medicine and not food as a way to treat yourself because usually when you feel like you're being treated by food, is usually not the healthiest stuff that you're taking in. And decreasing your sugars and your carbs in your diet are definitely going to be key for healthy weight management, feeling good, energy levels, and all those things.
So talking about cookies, snacks, and cakes, it is so hard because one of my things when I'm relaxing just before bed is I want a little treat. So
Yes, and you
either
know what? I learned for my new treat to be, it's more like a tea. So I like ginger tea, and I'll get the ginger tea with the elderberry or my immunity tea. And I'll make different teas with different flavors, and I'll put a little agave and some lime juice in there. But I'm finding other ways to satisfy my desires for something that tastes good, to also making sure that it's something that not only tastes good, but it's gonna make me feel good. So I think paying attention to that and being mindful when you eat, how food makes you feel. That's why I don't eat a lot of the food I used to eat now, because I realize that when I eat, what I thought was a healthy fast food place, Chick-fil-A, when I used to eat that, it would sustain me. But now when I eat it, it makes me sick, because a lot of the restaurants are putting a lot of different additives and they're processing their foods differently for mass production. And it takes away from the taste, and it also does not make you feel good, because a lot of it is just plain old poison.
but red velvet cake make me feel good. It has nuts
For
in
a
it. There's
minute,
some
it makes you
eggs.
feel good for the moment, but how do you feel after you have eaten a couple of pieces of red velvet cake? Your body is usually not very happy with you.
And that is true because I've cut back on my sugars. But what I did Thanksgiving, instead of me eating a whole slice, I only got a fourth of the slice. And it
Yeah,
gave
and
me
you ate it real
motivation.
slow.
Yes. And it gave me the
Mhm.
motivation to come back the next day to get that other fourth. And then that third day, I ate the other half. But at least I was trying.
That's right. And
Yeah.
moderation, I think, and portion control is going to be important, because I still eat a lot of the things that I enjoy. I just don't eat them often. And 80 to 90% of my meals are going to be healthy and medicine in my body. Whereas, more like 10 or 15% would be for my complete enjoyment. And I
Exactly.
try not to do it often. And then meal prepping, having the healthy foods around you, so you're not having to go grab fast food, preparing, planning, all of those things are going to be key in your healthy weight management, your healthy lifestyle and living. And then, of course, incorporating those supplements, because as we know, we're not always getting all the nutrients we need simply from food. We have to supplement with some good nutrients that God put on the earth, and that they are compounded in these amazing supplements. So go on the website, see what you need. Definitely start those immune supplements. If you're going in big spaces, flu, RSV, all of these things are out. COVID's back. So just be careful. If you know you're going to be in a crowded space, if you're getting on the plane for the holiday, you probably want to just go and put your little mask on, because that's going to keep you from getting there and feeling sick with all of that tainted air at the airplane level during this time of year. So it's okay to put your mask back on. It's okay to get your hand sanitizers back out. Make sure every time you putting your stuff up on that blade, on the roller, you're going through TSA, after you touch all those bags, after all of those other people touch your bags and stuff, that you are washing your hands, making sure you're wearing the mask in the crowded spaces on those trains at the airport, so you're not breathing in everybody else's germs. And then taking your supplements to help build your immune system, sleeping well, exercising, drinking the water, and making healthy food choices so that you can build your immune system and fight off all these nasty diseases out here.
I mean, I can't do nothing but say she right. At the end of the day, that's just it. At the end of the day, I still wear my mask. I keep them right next to my passport when I travel. Now, by the time I do get off the plane, I'm like,
Yeah,
fresh air.
right.
Yeah, I do all the things. I take my water. I've been exercising. So that way, as we continue to do our segments, I feel less guilty because I can say, yes, I've been doing all the things.
Yes, doing my part for my health. So if something happens and I get some terrible disease, it's not going to be because I just didn't give a darn and just gave up and did whatever I wanted to do. If I get it, it's because I was supposed to get it, but I know I'm trying to do my part to work with my own immune system and live as healthy as I can, so I can live well, so that I can age well, because you know I'm all about the vanity, but
Exactly.
also I want to have everlasting intimacy, like forever, ever, 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 ever. And you really cannot do that without your health. Your health is your wealth.
Because you don't want to be like on The Color Purple. How did he die on top of me? Y'all don't want that. Because we done
Right.
told y'all need to be drinking your water, eating healthy, and then that way be bang, bang, bang. See,
Right. And going to the doctor. So if y'all hadn't had all your appointments for 2024, make them at the top of 25. Ladies, make sure you having your annual your well woman exam, where you are having an exam, whether you have a uterus or not. You still need your gynecology annual if you're under 65. Make sure you're seeing your primary care doctor, especially if you're over 30 or you have some known medical problems like high blood pressure or heart disease or a strong family history. Still see your primary care doctor so you can get all those screenings and labs and tests that you need to get. Get your mammograms, ladies, starting at 40 every year. Men, get your prostate checked starting at 40 every year. Make sure you're doing your colonoscopies now starting at 45 or 5 years before your first degree relative was diagnosed with colon cancer. So making sure you're doing all the simple things, the lifestyle, but also the prevention and the screening, so that you can live your best life forever, ever,
and
ever, ever,
ever,
ever,
ever. And most
and
of
ever.
those you can get done at Me Bella Wellness because I was recently at the table. I got a 2-for-1 in and
A
out. It was
twofer.
amazing. And let me also say this finally, we'll get out of here. That sometime Dr. Mia herself may or may not be there, but guess what? Her nurse practitioner, Brittany, is amazing because a
And
lot of
Valerie,
times,
don't forget about Valerie too. I know you see Brittany more because you be getting all your pellets and stuff, but Valerie and Brittany, like I would not let anybody work with my people who are not great. I trust them 100% with my patients, and we discuss the patients. And when I'm there, even if you're on their schedule, you're still going to see me because I go in all the rooms and make sure that everybody's happy and make sure we address all your needs, because our goal is to give you the best care that you could possibly get, compassionate care and good clinical care that's individualized specifically for each person that comes through the Me Bella doors. You should leave there healthier than you came, with more information, feeling better, and us making sure we're doing all the things that you need to live your best life.
exactly, because I know some people get caught up with, if Dr. Mia ain't there, I don't want to see nobody. Her staff is amazing. And don't y'all do
Mm-hmm.
that to me on that bus. Joy, you ain't there. You always going somewhere that ain't going to be fun. Yes, it is, because really, it's more fun when I'm not there because they're nicer than me. I'm mean, but I digress.
Right. So yeah, and the other thing too is at Me Bella. This is the other thing I say. If you coming to me, if you want a doctor's office where you can go in and out and they don't really take the time to care for you, Me Bella is not the place. Sometimes you come, you're gonna walk right back and you're gonna get in and you're gonna get out and you're gonna be out in 30 to 45 minutes. Sometimes I may have a patient that comes before you that needs a little bit more of my time for that particular situation, and we may run behind at Me Bella. But our goal is not quick care, it's quality care. So all of our patients are going to walk out with what they need. We're going to diagnose what we need to diagnose. We're going to give you options to live your healthiest lifestyle, and that takes time. So our focus is not quantity of time, it's quality of care. So if you want to go somewhere where you can get good quality care and be well taken care of, and it's as timely of a fashion as possible, Me Bella is your place. If you're looking for fast, quick, in and out, Me Bella is not the place for you. But we would love to have you so we can take great care of you, because we decrease health disparities in our community and we make sure that all of our patients live their best lives. So we love y'all. Merry Christmas. Happy New Year. My update, let me do my quick update. We are doing a challenge in January. We just had our weight management webinar. I think our weight management consults are on sale for like $50 off. I'll be on tomorrow for Ageless Intimacy with Dr. Mia and Joseph, and I forgot what we're talking about, but look forward to January when we actually have our weight management challenge. The first full week starting January 6th. It's going to be a 4-day challenge. The 4th day is the VIP day, but it's going to be good, amazing information. I'm going to have some of my super friends to come and do some teaching as well. So don't y'all miss out. Now, what you got going on, Comedienne Joy? Because it's always a bunch of stuff.
Yeah, I'm just still doing my same tours, my Eat, Drink, and Ride food tours, still celebrating birthdays, still doing my distillery tours at Uncle Nearest. And again, I'm still booking travel. So I have clients going to Costa Rica, another one going to Antigua. A young lady, she's celebrating her 50th birthday in Cancun. So I'm booking trips and making people happy.
That's
So
what's
yeah,
up. Doing what you love. That's what's up.
exactly. So if you all want to get on the bus, if you all need a vacation, y'all want to hang out with me in February, I'm going to Venice. So I'm super excited about that. So hopefully I can do an Italy trip a little bit later, as well as a Greece trip that's on the website. So if you guys need a break to celebrate your weight management and all the things you've been doing at Me Bella Wellness, you all can join me. Go on the website at comedianjoy.com and I should have everything up there. If not, just hit me up and I'll be sure to get it up.
That's what's up. And then I see somebody said they miss being able to see me. Yeah, and I do get busy, y'all, because I operate and I do things that my nurse practitioners can't do. So sometimes I'm not in the office on Tuesday mornings. I do surgery and I do take vacations. So those are the times that you won't see me. If I'm out doing surgery, if I'm on vacation, but otherwise, if I'm in the office and you see one of my nurse practitioners, this year I've been able to go into most of the rooms. So most of my patients have seen me. I'm excited about being able to do that because I missed y'all too. But again, my nurse practitioners are amazing. So regardless of who you see, you're going to get amazing care. And we still discuss all of our patients, especially our patients who have some issues and concerns that we need to figure out and treat. So hope to see y'all over the next year. Y'all go live well, age well, and experience everlasting intimacy. Merry Christmas. Happy New Year. It's going to be an amazing year. I'm totally looking forward to this amazing year that's coming up. And nothing and nobody is going to stop me from having a wonderful 2025. And I don't go with fear. I go with faith. And I'm super excited about all the wonderful things that my God has in store for me and all the people around me that I love. So I am not fretting as I go into 2025. I'm looking forward to all the wonderful things that are about to happen. And I'm thanking God in advance. And I hope y'all are doing the same.
Amen.
Prosperity.
She done preached the whole sermon.
Look, one person cannot stop my prosperity and my blessings that my God has for me. I don't care who is in office and who is not. I'm going to have a good year, and I hope y'all are too.
Amen. And on that note, we can't wait to see you next year right here doing the same thing. But
yeah, I got one more day at work this year now. One more day because Dr. Mia getting a vacation. So when I come back in 2025, I'm going to be ready for it all. I'm going to be well rested. Y'all going to catch the fresh rested Dr. Mia, who gives even better care than the regular Dr. Mia. So I'm coming in. So y'all, everybody work on this year, getting your vacations in, your stress reduction, getting your rest, and taking some time for yourself for your mental wellness. Bye.
Y'all have a good one.